The World Health Organization's estimate of close to 15 million global deaths due to COVID-19 is nearly 3 times the official death count of just under 5.5 million as reported by governments. The WHO says it used statistical modeling to arrive at the expanded number, which includes deaths directly from COVID and from other medical conditions that went untreated due to the pandemic's strain on health systems.
This is extremely important information for anyone to have, especially policymakers and the public. We need to know the true toll of the pandemic. We have to remember that behind these numbers are people.
According to the WHO's report, COVID-related deaths in India were nearly 10 times higher than the official count. Indian health officials pushed back against the report Thursday, attacking the WHO's use of statistical modeling.
Please appreciate that these kind of assumptions to be used for a nation of our size, of a continent size, and to put us in poor light is not desirable.
Other countries with large discrepancies include Pakistan, where, according to the WHO, excess deaths were 8 times higher than the official COVID death count. In Egypt, it was 12 times higher. And in Mexico, it was double.
I think the experts all along were very aware of the, let's say, shortcomings or tools that were not available right from the beginning. So the amount of testing, et cetera, would mean that there were many deaths that went unaccounted for.
The WHO says most of the excess deaths were concentrated in Southeast Asia, Europe, and the Americas, and were in middle-income countries. They also confirmed the global death toll was higher for men, who accounted for 57% of deaths. The WHO is the first to caution that its report on global COVID-related deaths is an estimate and thus imperfect. But the agency says it is nevertheless important to get an accurate accounting of the pandemic's toll to better prepare for future threats. Heidi Zhou-Castro, Al Jazeera, Washington.